what does the Ontario MD organization, what do you guys typically work with the physicians in the community of like how
Yeah.
to use their technology better?
Yeah, so we have a very unique way of doing it. So we have a really robust change management and adoption division. So there's a number of divisions we have within Ontario MD. We have got a technology division that's responsible for certification of EMRs. So we're one of I think the only province that has a certification. So if you're an EMR vendor and you want to be in the community, you need to be certified. And so we manage that program. We also manage the vendor engagement program piece of it. So if there's things that we're advocating for that we want vendors to do, that's where that would be. If there's places where the province want the vendors to put a new functionality, that's where we would play. And so coupled with that is really the education piece and the change management piece that we're just talking about. So we have two ways of looking at it. One, we have staff, hired staff, that's part of our change management that go out, that are experts in the EMR and experts in workflow. And there'll be a number of places that they touch. So they'll go clinic to clinic. So our staff live throughout the province. So if you're in Northern Ontario in a rural area, there's a staff member that understands your reality because they live there, they function there. If you're downtown Toronto or downtown Ottawa, you have staff that live and function there. And so that gives us an advantage in that we really understand what's happening in the local health system. And so we'll go to your clinic. We'll go to your clinic and we'll help your staff and we'll say, okay, here's a new digital tool you should use. We'll help you use it. We'll onboard it for the staff. So that's kind of what we do at OMD. We also have a really unique peer leader program. Our peer leader program, think of it as consultants. So we have about 60 odd consultants who are family doc specialists, office managers, or nurses. And they're that peer to peer. So, Jordan, when there's a doc telling you what to do, you're more likely to listen to it than when there's someone else telling you what to do, right?
Physicians trust physicians. That's just
This
how it
is
is.
it. Right. So if you have someone from an organization coming in and saying, okay, Shandy, you're doing this all wrong. You should use your EMR better. I've got all 1, 2, 3, and 4. Let's change it. I'll probably be like, you don't quite understand where I'm coming from. And you're right. I probably won't listen as much. But if you have another doc who's in your community, who uses the same EMR and who's kind of slogging it away with you, telling you, hey, you're not doing this right, I can save you time, you're probably going to listen to them and be more likely to onboard it. So it's really that one-to-one, and that's why they're called peer leaders, because it's peer-to-peer. And so it's the combination of everything that really allows that change management to happen.
Very cool. I mean, there's just so many people vying for our attention and
I
for our,
know.
trying to get our brains to pay attention to them,
I know.
whether it's a vendor, a service provider, a medical student, whoever, right? And so having something to help cut through that noise, and again, that peer
Yeah.
mentorship aspect of it, I think that probably goes a long way to helping with that.
It really does. And then we also offer conferences. So we have 2 digital health conferences this year. One's virtual in June. Anyone can sign up for that. And then we have one in person in September. Again, anyone can sign up for that, but less likely to come to Toronto if you're in Vancouver, whereas the virtual one you probably could. And what we focus is on tips and tricks. We focus on how to use your technology better. But we also focus on delegation. And that's really important because you don't have to do it yourself. You can delegate it to your staff. You could find a staff member who's like a super user and they could learn how to use the EMR or technology. And then they could in turn teach everyone else, right? It doesn't have to fall on our plate. We often feel like it has to be us and we just don't have time for it. And you're absolutely right what you were saying before. We don't give technology the attention it needs to have. Like when we talk about a medical illness or chronic disease, we're signing up for every conference possible. But when it comes to digital health, it's not really up there in the forefront. But if you knew what was out there and you knew how to use it better, it would actually make the clinical part a little bit easier. So it kind of goes hand in hand.
Why is that? Physicians are very skeptical with digital health, yet everyone seems very cognizant of
Yeah.
burnout running rampant and the admin burden and all these like problems. But why is everybody sort of pushing it to the back burner of that digital adoption?
You know what? I think there's when I look at our knowledge base and medical school and what we're teaching our learners, there's huge gaps. So one gap I would argue is practice management, how to run a practice in the community, how to bill efficiently, like what to use to actually make your life better and have that life balance. Like we don't get any of that. And then digital health is the other thing. You're kind of thrown into mostly a hospital when you're a learner. So you're learning these HIS systems or these hospital systems. In the community, if you're going into family medicine, it really depends who your preceptor is. And if your preceptor doesn't understand how to use the EMR, there's no way you're going to learn how to use the EMR, right? So I think it's kind of trickled down. Like we're just not putting a focus where we need to, which is probably in medical school onwards. And I think the other part is don't let people understand how it could help them. Because when technology came out, it wasn't like all the docs were on board. Yay, we need an EMR and we're part of the co-design and we've decided we want it. And then we work with the government to get it. It was more like top down. We've got these EMRs. Now we want everyone to use it. So whether you like it or not, here it is, go. And so you never really got that buy-in initially, right? And then as we progress, unless someone is really interested in the technology or if they've been inspired somehow as a learner or they had a preceptor that was amazing, they don't get that access. They don't see it. And I think that's part of the reason why change is so hard for us. Um, and really, I mean, we always hate talking about resources and funding and but that's part of the problem, right? So when you're in the community, as opposed to being in a hospital or a community health center where you're salaried and there's lots of support and people to do this or help you with, in the community, all of us, we're kind of little mom and pop shops. And so for us to use our technology better, to onboard it, to put this in play, it's costing us money out of our pockets. And so it's not really a priority for us because we're just so busy actually getting these patients in through the door that it's not something we want to do, right? It's not something we feel we want to do. And I think that's a big barrier too.
How do you flip that around, I guess, right? Like where the incentives line up. The
Yeah.
doctors every year, we got to get our CME credits. Does the
Yes.
Ontario MD, the
Yeah.
annual conference, I mean, does that
Yes.
help incentivize learning about and interacting with digital tech that way?
Yeah, it does. So I think the credits are important, but these one-on-ones that I was talking about where we come in and chat with you, those are accredited also. You can do
Cool.
self-learning credits for those,
Cool.
right? And a lot of those are QI credits. Like there's like a PDSA cycle. So in Ontario, our CPSO, they tap us every 5 years now to do a QI project. So
Hmm.
what I say is use this as your QI project. My QI project is I'm going to use my EMR better that I gain an hour extra a day or something like that. And you can actually use it for a couple of things. And I think it's about finding the needs. So the needs, right? So at OMD, and part of my job is to understand what are the needs of the community and then meeting those needs. So your need might be, I'm overwhelmed with my inbox, like completely knackered. I'm here like hours at the end of the day and I have to go through all these labs. And these patients are calling me all the time and now they're texting me all the time. I can't handle all these messages. Okay. So there's a technology to help you with that, right? So then if that's your need and that's what you're going to put effort into, then it's kind of coming in and saying, well, we can set up some automatic templates in your EMR. We can help you with a toolbar. We can monitor your patient portal and we can kind of set up a couple of other things there. And so now you're using a technology to meet your need and you're going to learn a little bit more about it. And then you'll be like, hey, this actually helped. Let me look at this. And then you're kind of more open to learning, right? And I think you need to start with the needs first. And that's where the problem is we start with the education. You have to learn this. And here's 3 topics, right?
Hmm.
But think of medicine, right? Like, where do you go for a conference, right? You're not going to go to diabetes if you think you're like a superstar at treating diabetes. You're probably going to go to maybe the dermatology conference because all the rashes look the same to you because that's your need. So it's the same kind of thing. You have to approach it from a need perspective.
That's super interesting. I would have never thought like of QI in that context of like digital tech and workflow.
Yeah.
It's always how many of my patients are compliant with the latest screening guidelines or something very
Yeah.
clinical like that. But
Yeah.
so you can actually take it and make that into your annual project or
You
however your
absolutely can.
cycle is. Very cool. I'm Dr. Jordan Vollrath, and you've been watching Cherry Live, brought to you by Cherry Health. Please like and subscribe to see more clips like this, or check us out at www.cherry.health, Canada's medical network.